Good stuff to cover tonight. There'll be a few people filtering in, but the big thing that we're going to cover, and going on the board over here, a couple of the heart disease myths that we might have heard. Heart disease is not preventable or reversible. Has anybody heard that? Once you have heart disease, you always have it. You can't reverse it. You can't get rid of atherosclerosis and that plaque. That is not true. And a few of the books that I've been reading, researching information for this heart talk, specifically I've been talking about what can you do to reverse damage that's already been done. So let's say we have heart disease, we know that it runs in our family, we find out we've got some plaque, or maybe we've even had an adverse heart event. There's some specific things in your diet that you can change that you've been able to show actually reversal of atherosclerosis on film. Second, high cholesterol is bad for anyone at any age. And I know that for sure if you've ever watched television, you're going to hear this message pounded into your head over and over again. Cholesterol, #1 enemy of the heart, and by Lipitor or one of the other medications that you can lower your cholesterol. And for certain, they've done study after study after study that shows those medications will definitely lower your cholesterol. But is that necessarily a good thing or not? What some of the new research is showing is that for some groups, higher cholesterol actually means less chance for death, less chance for cancer, less chance for Alzheimer's. So we've been led to believe that cholesterol in and of itself is the sole enemy, and if we can eliminate cholesterol, then our heart will be good. Some of that sometimes is not true. And definitely as we age, for people over the age of 70, that's definitely true that higher cholesterol is going to be better for you. We'll learn why, and we'll learn what cholesterol is, what's good for. The third one is, if heart disease is in my family genes, anybody have heart disease in the family genes? Yeah.
Oh, okay.
It's in my family. If you have heart disease in our family genes, that we're going to have heart disease. So that's not true either. Epigenetics is a new science that's coming out now, and what the study of epigenetics is here's my genes, but how come I only express some of those genes? How come I don't express all the genes? So you can look at twins who have the same genes, and one of them is healthy and one of them is not healthy. How come they're not expressing the same genes? And what they're finding is through the study of epigenetics is the gene is either turned on or off based on things that we're doing in our lifestyle. That's the study of epigenetics. So how do we turn on part of the gene? And you can actually pass that on to your offspring if you turn on or turn off a gene. So it's kind of interesting how that works. So we'll learn a little bit about that. So the bottom line is heart disease, heart health is in your hands. We're going to learn about what can we do or how can we control that to make that work better. So the sad news is that cardiovascular disease is still the #1 killer in the United States right now. There's a little game that says if you look to your left, you look to your right. One of those two people is going to be the victim of heart disease in the United States right now. Unfortunately, that's the stats. But that's the average stat. If we can do some things differently, that doesn't mean that that's going to be us. So 1 American dies of heart disease every 30 seconds, and 1 from a heart attack every minute. So lots of people, unfortunately. The stats: high blood pressure, 73 million. Coronary artery disease, 16 million. Heart attack, 8 million. Number of people with one of these above things: stroke, angina, heart failure. Over 80 million people in the United States every year. That's a lot. So here's the old plan. We wait for pain and wait for symptoms and try for early detection of heart disease. So when we hear the new health plan, how do we prevent heart disease? It's not about preventing heart disease, it's about detecting heart disease early and then trying to change things at that time. It's kind of like jumping off the cliff and we're looking for the guy that's already falling to try to prevent him from hitting the ground. That's not the way to do it, because by the time you feel pain, it might be too late. In fact, heart disease specifically, 25% of the time, the first symptom of heart problem is actually sudden death. So if we wait for our first symptom, that's too late. What they're finding as they're researching, they're finding kids in their early teens, 20s that are already developing signs of atherosclerosis. We were thinking long ago that it was not a disease until you're in your 50s before you have to start worrying about it. But now they're finding young kids that are showing signs of heart disease already. So we want to be proactive, not reactive with our health, which means doing something about it before we start to find the symptoms. Putting up a fence at the top of the cliff so we don't fall off. So the genetic myth, it's the old argument of nurture versus nature, genetics versus junk food. And basically what they're finding, one of the books I read is a book called The China Study. It's a really interesting book. And what the China Study is studying in China, where they used to be very unmodernized, and ate a very different diet than what we eat here, and they're studying how does that change as China becomes more modernized. So what's happening to the Chinese people as they start to eat differently, act differently, stress differently, and what they're finding is in China, the population of the United States has become obese in the last 10 years. That's how many people have gone from normal to being obese in just the last 10 years, the population of the United States. So as they're changing their diet, they're seeing that things like heart disease and stroke and heart attacks, those things are rising very rapidly. So if it's just genetics, the genetics doesn't change within the last 10 to 20 years. That takes a long time to change. So it really is, what are we putting into our bodies, what are we doing to ourselves? You can see here, diabetes, obesity rise rapidly within just 15 to 30 years. The genetics of a nation doesn't change in that short period of time. So, environmental factors like pollution. Unfortunately, we watched the Olympics and we saw the pollution that was in China and in the United States. These are being passed down and changing how our genetics are being expressed. So the good news, though, is heart disease is definitely one of the most preventable diseases out there. If we can change some things, definitely, study after study shows, you can definitely change your body's likelihood of getting heart disease. Definitely genetic predisposition, but they're saying that might be only 5% of the actual truth if you're going to get heart disease. Major factor is going to be lifestyle. So, the old beliefs, high blood pressure, cholesterol are the biggest risk factors. What they'll tell you, take blood pressure medication, take cholesterol drugs, and you'll be fine. But when you go to the heart ward up in St. Paul, to some of the different hospitals, and you look at the people that are laying in the beds, and what medications are they taking, and where is their blood pressure at, we'll find out that they're taking 2 or 3 or 4 different blood pressure medications, and their blood pressure is being controlled, and they're on a cholesterol medication, and their cholesterol is being controlled, but yet they still have developed heart problems. And why is this happening? The problem is you can't keep doing the same thing that's causing the problem and just take the drugs to cover up the problem. It's not going to fix the problem. Drugs definitely will lower the blood pressure, definitely will lower the cholesterol, but that's not the answer. So medical literature shows that as we age, blood pressure slowly goes up. So one of the stats is if you take your age plus 100, that's where your blood pressure should naturally be, the top number anyways. So it's kind of interesting because we start to think about that our blood pressure needs to be real low, but as you age, your blood pressure naturally just goes up a little bit. Doesn't mean that it's a problem, it's just what naturally happens. So high blood pressure medications, lots of people are on them, artificially lower the blood pressure. Oftentimes we need more than one drug. We'll talk about why that's going to be necessary, and basically because they're not fixing